There's something which we call motion palpation, okay? And everyone, any chiropractors or osteopaths or manual therapists who have studied, spinal manipulative techniques and, higher levels of mobilization techniques, they will understand this. So you hold a segment of the spine and we get it to move, okay? So you're feeling how something's moving. And this is the difference between what we do and, the conventional kind of approach. In the conventional approach, when you assess something, you assess a joint, what do? You might take an x-ray of it, or you might take an MRI scan of it, or you might take a blood test. You're not looking really at how things are functioning. So what we're doing is we're using what I would class as one of the arts of medicine. Medicine is an art form, and if you look in history at how people used to practice, manual techniques and these sorts of things used to be part of that, which is something we've kind of lost today. But we're having a feel of how the joints are moving. There's so much more fluidity in this movement today in terms of what we've had in the past. How does that feel?
You know what, it feels lovely. And you can feel the knots been hanging around.
Yeah.
And it's getting so much better.
Good. Okay. So it's important to make sure that when you're using such techniques that the patient's comfortable with it, they're not tensing up, they're not in pain. Sometimes it can hurt, but there's a kind of a good pain as well, right? Would you agree? Yeah.
It's a funny, you just gotta laugh it off. That's all you do, laugh it off.
Okay, so in our soft tissue workshops, we've taught techniques as well. We've got a very specific way of using even my hands and different ways that we use soft tissue manipulation techniques. But I want you to just rest the head down so we're not contracting any of those muscles. And what I'm doing is I'm carrying the head around and I'm giving a little bit of movement and kind of getting a little bit of a pulse into the tissues and in the joints. Okay, and now we're focusing right into the soft tissues. Okay, so we're going right into the posterior neck, and I'm putting quite a bit of firm pressure. Is that pressure okay?
Okay.
Yeah.
Exactly where the problem is.
Yeah. Right, you okay?
Yeah, go on.
Yeah. And you can see that I keep checking, because I can't see your face. Obviously there is a mirror, I can't see it, but because I'm not constantly looking at your face, I'm always getting feedback from patients. Are you okay? Are you alright? Is that alright? Sometimes it's probably, I think patients think it's a bit annoying that I keep asking, but I've got to make sure.
I just felt a little bit of a crack just there then when you're pressing in. I tell you what, every time it cracks it just feels 10 times better. Yeah. And that's what it's bizarre, you want that feel, because that's what helps.
Yeah, and the interesting thing is I'm not adjusting your neck, I'm not actually trying to crack your neck right now, I'm just
loosening it up.
Yeah, getting the joints moving. Because, day to day, how many of us get this amount of movement in our neck? Even someone who doesn't have neck pain, how much movement are you getting into your neck? And how much are these joints moving? And if you think about the physiology, if you understand the physiology of how the joints work, movement is part of their maintenance. If you don't move a joint, it's like a car. If you don't start the car, you leave it sitting. I was telling you about my Mrs. car before. My Mrs. car is just sitting there doing nothing, and it's just rotting away, right? So it won't even start anymore. So this is an example. Joints, same thing. If you don't use them fully, they just the health of the joint deteriorates. Okay, so we're doing as we said again. We're just getting some mobilization.